Yeah.
Hi there, this is Reena Jadhav. Welcome to Heal Circle. It's a live stream and we are chatting with Falguni Dave. Falguni, welcome.
Hello. Great to be here.
So we are going to have you tell us a little bit about how we can stay limber and stretched out and happy through the corona time.
Okay, great. So today I am going to show you guys a great stretch that you can do right at your desk because, and this is a dining table, I'm sure this is a desk for many of us today. So when you are sitting for a long time, what happens is your thoracic spine is your mid-back, which is right over here, that tends to get really tight. Tightness in the thoracic spine, what it does is it leads to sprains and strains in the neck and the low back, because when you rotate, the reduced mobility in this area then causes your body to sort of jerk, when you're trying to rotate around and look back. So this is very easy. This is also called a modified child's pose. But what you do is, let's say you are just sitting right over here and you want to scoot your chair back just a little bit. And then at this point, you're going to just slide your hands forward and you're going to slide them until you feel the stretch right in your lats or your latissimus dorsi muscle right here. When you feel the stretch, hold it for about 5 to 10 seconds, depending on how comfortable your body feels. And when you are there, I want you to make sure that your neck is in a neutral position, meaning that you're not looking down like this, neither are you up. So from this point on, you're going to slide both your arms to the right side. And then right here on the right side, what I want you to do, to the left side, go all the way to the left. And then with your right arm, I want you to reach forward just a little bit. So what that will do is will give you a great stretch in the right side of your low back and your mid back and the side of your back and even the arms. Hold this for 10 seconds. Then crawl your fingers all the way to the right side. And then when you get to the right side, reach forward with your left arm. Get that stretch. Hold that for about 10 seconds. Then come to the middle. And right here, it's very important that you slide your hands up on the table. I don't want you to just go up like this. And also throughout this, make sure that your back remains straight and you're bending at the hips. Okay, so if you want to try it with me, we can try it together. Ready? And let's go. So we're gonna slide forward, slide to the left, reach with your right arm, slide all the way to the right side, reach with your left, to the middle, and up again. And you can always finish this with some shoulder rolls in the backward direction. Make sure those shoulder blades are moving. Just don't do this. Up, back, and down. About 5 to 6 of these shoulder rolls. And that's it. That is your thoracic stretch on the desk itself. Thank you.
I love it, Falguni. What an important stretch for all of us to be doing, because unfortunately, we are all stuck at home these days doing these Zoom calls back to back to back. So even when we went to work, we would get up a lot more, we would roam around a lot more, the office schooler conversations. These days, it's a lot less of that and a lot more of just being locked on, in your office or on your couch, just sitting. So this is such an important stretch that we can all do to make sure that we are going to continue to be pain-free long-term. Thank you so much. How many times should someone do this, by the way, in a typical day?
You should do, you can do this stretch 3 to 4 times a day, Reena, but I've also showed other stretches previously. And so my advice is always every hour, every 45 minutes to an hour, do something different than what you're doing already. So do one stretch, you know, you can do your shoulder rolls, you can get up. So yeah, if you just want to do this one stretch, do it 3, 4 times, but ideally combine it with the other stretches and do something every hour.
Wonderful. Well, thank you so much again. Tell us a little bit about Back on Track. So those of our listeners or viewers who are interested can follow you and get access to more such wonderful tips.
Yes, we're a great team of physical therapists. We're in Pleasanton as well as in the Walnut Creek area. And we are now doing telehealth. We are open. We have actually never closed throughout the pandemic. We are trying really hard to keep our physical therapists busy. We have plenty of free programs available via Zoom or via telehealth as well. So give us a call, go to our website. It's www.backontrack-pt.com.
Fantastic. Thank you so much again. All right. So we have one comment from one of our live stream viewers. She says, still doing neck stretches that we did, that Falguni, you taught us. And she says she's doing it with her staff. This is Dr. Duggal. And she says she's still doing those stretches with her staff.
Great, that's great, Dr. Duggal. And even with this modified child's pose, you can always incorporate breathing as well. In fact, instead of counting 10 seconds, just count your breaths, 2 or 3 breaths at every position. And so this way you can get your breathing as well as your stretching in.
Fantastic. All right. Well, thank you so much. We are going to now say goodbye to Falguni from Back on Track, and we are going to welcome Dr. Eena Duggal, who is going to be joining us today to share what it is like from the front line. We are just waiting for Dr. Eena to turn on her video. There she is. Welcome, Dr. Duggal. How are you?
I am good. I'm good. Thank you for having me.
Oh, our pleasure. Thank you for making the time.
And thank you to Falguni. I tell you, those stretches, even I do them, and they come in very handy. It is great that we have the, the expertise and the opportunities just within our own, group of friends to share our expertise and our knowledge. It's awesome.
It really is. We're so blessed to have all of you as our partners, as our supporters, as our champs. So Dr. Duggal, what are we talking about today? Now, you're in the front line. Tell us a little bit about what are you seeing. Now, we are very blessed. We're in Pleasanton, California. Pleasanton has had 44 cases as of yesterday, which is actually higher than the neighboring towns. Our neighboring town, Livermore, has only had 17. Dublin's at about 21 or so. I think Danville's at 27. We are definitely a little bit higher at 44. What are you seeing? And you're now at this point working at Stanford Valleycare.
I am. Correct, Stanford Valleycare. So what are we seeing? We're seeing, thankfully, a change in the curve. We're starting to see the curve sort of, turn over the top. And that's actually happened very much more recently. I mean, as you know, in the country as a whole, I think Friday still had, or the weekend still had, over 2,000 deaths. I mean, we're still dealing with large numbers. But if you look at the sort of area that we're in, if you look at, Pleasanton and our sort of Stanford network, we, I think, had 146 positive COVID cases out of all that were tested. I mean, that's a very, very small number compared to the number that we're now testing. So we are seeing, fewer patients that are turning positive on the test. What's really nice is our testing has really ramped up in the sense that we're testing people with minimum symptoms now. I mean, you have to have, I think, it's not like you have to have fever and cough and shortness of breath. I mean, you don't have to have a lot of those sort of symptoms that we were looking for before. You could have even one of them or two of them, if that. You have to have some symptoms. And the turnaround time on these tests is really good. So we're testing more, but we're not seeing actually that same number of hospitalizations for sure. And we're definitely seeing a decrease in the number of COVID positive testing patients as well.
where are you seeing most of these patients getting infected from?
You know, it's definitely community spread, Reena. I think what we're seeing by far is, I mean, one of my patients told me who was positive, and I think she and I were both blown away. She said, you know, I haven't left the house in 2 weeks, except I went to the Costco not to Costco, sorry. I went to Target in Santa Clara to pick up toilet paper because there's no toilet paper around here. So she went down to Santa Clara. Why there? I don't know. But, and she had a positive COVID test. And she thankfully, you know, is recovering. And she was unwell though, up and down, you know, really up and down for, I'd say, almost 10 days. But now she's doing much, much better. But literally, she went into a store where she was surprised at the number of people, but she doesn't remember anyone around her in any proximity that was, you know, coughing or sick or anything that she recalls. So yeah, we are seeing it. We're seeing it out there. And, you know, you've seen the studies now talking about, I mean, you sent this, Reena, you know, it's like, is it on your shoes? I mean, do we need to leave our shoes outside the house? I mean, I don't know how far apart is safe enough.
I know.
Clearly, we don't think it's 6 feet anymore.
It's definitely not. There's a couple of demonstrated videos where the microparticles can go up to 27 feet. They've done this through infrared cameras where they've captured, or even just loud breathing from a runner can carry it in the wind for, you know, pretty long distances. And yeah, Eena, there were 2 specific instances that were brought to my attention where the couple had been together, they were never apart. He got diagnosed on a ventilator. She is still diagnosed, she's still testing negative. No symptoms and is testing negative. And so we have this very contrarian perspective on the reality, which is it's everywhere, it spreads through everything versus
it's droplet spread, it's aerosol spread, it's, you know, we honestly don't know. I mean, there was a lot of, you know, talk that it's not aerosol spread. Well, I'm not convinced of that. I do think that there's aerosol spread. Otherwise, how are these people who have not been in close contact with others picking it up?
And yet there's a couple where the husband's on a ventilator and the wife is still negative. So I don't think we've understood truly.
I mean, that other couple that was on CNN the other day, Reena, they were talking about who, sadly enough, the husband actually passed, and he was only 30 years old. 30 years old, and he passed away, and the wife was never positive. I mean,
exactly.
30, hospitalized, you know, got sick over 24 hours. And sadly enough, passed away, and the wife was never positive.
Exactly. So we're missing something. I think we started with the premise that this was a variation of the flu virus. And, you know, we've had history with the whole SARS. And so we've all just assumed that this is just another iteration of that and it's coming from bats. And I personally don't think we've looked too deeply into the fact that this might be something slightly different because it isn't presenting like a normal flu virus would present. And everyone I speak to on the MD side Frontline that's interacting with it says people need to really stop calling it the flu because that's really not what it's looking like.
No, and I think that's just it.
We call it the flu, and then people are hanging out. We had an instant where people are still getting together. I mean, there were $1,000 tickets given out to some folks hanging out in Santa Cruz, thinking this is a good time to hang out at the beach. So anyway, okay, so we don't know, which is why we all have to be really careful.
Absolutely. I think we absolutely need to social distance and still be very careful, and we need to and I think we need to really understand, you know, understand what it is that we're not all going to understand what's going on with the virus. So I think what we need to understand is, you know, in our own families and certainly with our, you know, circle of friends and with whatever other relationships we have, colleagues, that sort of a thing, make sure that there's an understanding that, you know, what we're doing and why we're doing it. You know, what are we doing this for? We're doing this to protect the elderly people in the population. We're doing it for our parents, for our, you know, for our grandparents, for our, you know, our immunocompromised people. But what we also want to understand is, you know, why is it that some people who are 30 are passing away and some people who are immunocompromised are passing away and other people who are not immunocompromised are passing away? Like, what is it that makes people different? And I'm not that we have the answers to these, but I think what's really important is understanding your own immune system, you know, and trying to kind of, you know, get a handle on what can we do to sort of, you know, do the best we can to really boost and support and have our, you know, rev level of our immune system, have it rev up here as opposed to revving down here. because that's when we're more apt to kind of, pick up things, whether it's a virus or a bacteria or any infection, any illness leading to chronic illness even. But if we're revving, not up, if our immune system not revving up here, then we're not sort of doing the best job we can to fight off what our body is meant to fight off.
Absolutely. What are the things that you are doing to keep your immune system calm and ready for the coronavirus when it decides to show up? Because apparently we're all going to get it.
Yeah. I mean, what can you do? A lot of the basic obvious stuff, right? I mean, you want to make sure you're sleeping well enough. You want to get enough hours of sleep. You want to make sure that you're eating well. I mean, diet has such a huge role to play in so many, chronic illnesses and so many illnesses. I mean, our immune system is basically a reflection of what we're putting into our bodies, right? So if we're not putting in the right things into our bodies in terms of, vitamins and minerals and elements and all of the nutritious food, if we're not doing that, then you're not supporting your body's function to be able to fight off and do what job the body is supposed to do. Our body will do this for us. Our body will, if you kind of give it the proper fuel and the proper engine to kind of, boost it. It will do it. So what are we doing? We do the typical vitamins for sure. I think a lot of people are sort of, poo-pooing the vitamins, but I mean, if you get enough in your diet, you're probably doing well. But if you don't, why not boost them with a supplement? Why not? Everything from vitamin D to vitamin A to vitamin C, E, zinc. I mean, we talk about all of them. Probiotics, I think gut health is really important. And so boosting the sort of, the microbe and the biome in your gut to try and make sure that you've got sort of, again, you've got all your defenses forward, foot forward. And in doing that, you can sort of try and ward off. And what I really don't like is how people seem to sort of think, well, we're waiting for the hope of a medicine. We're waiting for the hope of a vaccine. That will happen. But in the meantime, what are you doing about trying to boost your own immune system? Because if you've got a revved up immune system, you don't need to wait for the vaccine.
Absolutely, absolutely. Let's talk testing for a moment.
Yes.
So I know that different cities, states, hospitals, all are doing different things. It's actually very chaotic out there. There is not a streamlined, generalized testing model today that's pervasive. What are you doing at Stanford Valleycare in terms of testing? How much does it cost? Who can call in and do it? Like, just give our audience just
absolutely. So I think we're very fortunate. I mean, Stanford, of course, having the big, organization and the hospital, with it, has been really in the forefront of doing the testing and providing it to patients in sort of a efficient and fast manner and turning the test around very quickly. So, I mean, we went at the beginning with all kinds of, again, testing criteria, because we didn't have enough of the tests. And we didn't have sort of a quick enough turnaround. It was only for the really, really sick people. I mean, it was almost like you needed to be hospitalized to be able to get a COVID test. Clearly not the case anymore. As I mentioned, the testing has really opened up. So we used to send them to LabCorp, and LabCorp was giving us about a 2 to 3 day, I would say, turnaround at best. 2 to 3 day. I mean, having said that, I had a patient of mine who lives in Stockton who told me just literally on Friday, her lab test done in Stockton didn't come back for 7 days. And this was at LabCorp. That is just, unacceptable at this time. It really is. We sent all of our tests to Stanford, of course, over to Palo Alto, and our turnaround has actually incredibly increased. We're now at well under 24 hours. So we will see COVID tests coming back in I'd say more like 12 to 15 hours. So under 24. Consistently, even over the weekend, our tests are coming back in well under 24 hours. And we are doing the drive-through swab. So you can actually go to any local physician, unrelated to being a Stanford patient, anyone at Valleycare, because I'm a Valleycare physician, right? I see patients at Valleycare. So we can even order as a Valleycare physician, unrelated to, again, being on staff at Stanford, order it for a patient with symptoms, and it's a drive-through. And they will do it every single day, Monday through Friday, they will do drive-through testing. And like I said, that turnaround, because it's all being sent to Stanford Hospital in Palo Alto, that turnaround is under 24 hours consistently now.
That's incredible. So it isn't limited to people with symptoms, right? Just confirming.
I missed the question, Mandan.
So it's not limited to people with symptoms. Anyone can
No, I wouldn't say anyone. So if the doctors are ordering it, we're still looking to have some sort of symptoms, but it doesn't have to be a myriad of symptoms. What
Okay.
happens now is a lot of people say, and I think even you said this to me, Reena, before, is I'm sure I had COVID, right? I
Yes.
had these symptoms weeks ago.
Yep.
I'm positive I had COVID, right?
Yeah.
I hear that a lot from patients. Oh, I had this or that. And I'm finding that a lot of people I'm testing are actually negative for COVID, but it depends on the timing of the test. So when are you testing, right? Are you testing them in the sort of that, have they built the immune response, or have they built enough sort of an immune response? I'm not talking on antibody now. I'll talk about that in just a minute. But I'm talking just enough of an immune response to even have a positive test, enough sort of, viral load in your body. And then we're looking at, so you have to have that sort of positive, and you can't be too late in the game because then it's not going to be positive either. So the testing that we do is kind of really in a very short window, it'll turn positive. So your question, Reena, is, I'm sure I had it before. Can I test to make sure that I have it? Any of the COVID tests I do now will not tell you that. However, we are now doing, and actually this is sort of fairly new, hot off the press, the last, I would say 4 or 5 days, we are doing antibody testing. The problem with antibody testing, though, I will tell you, is we don't know what to do with the information of the antibody test. So you look at the antibody test and it's like, okay, you were exposed. Okay, so does that mean I've built immunity enough if that antibody test is positive and therefore I know I'm not going to get it again? Or does it mean how long ago did I have it? Like, am I still, or am I contagious even? Do I need any sort of, so-called treatment? Because there's a lot of different treatments that people are talking about. What do you do with the information? And this is the problem we're having with the antibody test right now is we don't know enough about how those results are panning out. So we don't know if it makes sense to test someone because what will you do with that data?
That is so interesting. I have a section mate from Harvard Business School, Joe Driscoll, who I spoke with yesterday. He is a founder of a fabulous company called Evolve Science, and they are now looking at antibody testing and scaling that and making that available. And so I got a good insight, intel into what the heck is the antibody test anyway, and what are we going to do with this thing? Because exactly like you said, I think for most people,
Exactly.
we're just too early into this. And so what I'm understanding is that these antibody tests can help us open the country back up again. So if I can...
Well, can they? Reena, can they, right? I mean, what information are you getting from them to be able to say that you're safe enough and you can open up the country again, right?
That you are exposed and you are no longer shedding the virus. So those are the two things that they're looking for.
Yes, but that's not what the current antibody test is telling us. See, that's the thing. It's not telling us that. IgG and IgM is not telling us if we're currently shedding virus. That you need a viral load for. Totally different test. So that's not an antibody test. That's a viral load test. And the viral load test will tell you if you're still shedding virus.
And
so,
are you doing that as well? When are you?
No, we're currently not. What we are doing, which I think is really helpful, but this is again patients who have been positive for COVID, and I'm telling my patients to do this now because this is fairly new, is Stanford is taking convalescent plasma. So what they're doing is somebody who's had COVID and they have built an immune response. I mean, they're doing this in other parts of the country as well, but I'm just saying Stanford now has a study. They will take convalescent plasma from people who have recovered from COVID. So at least that way they're doing the studies on these tests to figure out, what do the antibody tests mean? And can we do viral load testing? And what is the explanation for these test results? So that's the studies that are happening, but it is a COVID positive patient. Like another patient again said to me, well, I'm sure I had COVID 2 months ago. Can I donate to this? And I'm like, you can't. I mean, because right now, basically what we're doing is taking only patients who have truly been positive to COVID and then taking their plasma.
Got it. Wow, so many complexities. Certainly not as simple and slam dunk as we'll test you and we'll put you back into the real world.
Yeah, no, it's not. I know everybody would like that sort of, magic test and sort of, quick answer to, I want to know if I'm protected. I want to know if I can go back to work. I want to know, did I really have it? Can I give it to my kids and my family? And if I knew all that, I'd be good. Well, we're a ways from knowing that kind of information. We really are.
So let's just summarize for those who've been listening and are now more confused than when they came in before. Yes. So there are 3 kinds of tests. There is the test to find out if you are positive for COVID-19. Right. There is the test for the antibodies.
Correct.
And then there's the viral load test.
We're not doing the viral load test right now. We're doing the convalescent plasma test.
Okay. So that's the
And
fourth test.
only if you're COVID positive. So a convalescent means someone who's recovering from an illness. That's the definition of convalescent. So convalescent plasma means you take the plasma, you take the blood from someone who's recovered from COVID.
Got it. Got
Do
it.
further testing on it, like antibody testing. So we want those antibodies, right? So there, I mean, these are for, I mean, it's also being used for vaccine studies. It's been doing, that plasma is being used for a lot of things, right? So the vaccines that are being kind of, you know, worked on in the country, they need antibody, I mean, they need to build an immune response to get those antibodies to be able to then replicate them and then make a vaccine out of them. And those antibodies come from healthy humans who have not had COVID, which is more vaccine study testing. That's totally different. That's not what Stanford is doing that I'm just talking about. But the convalescent plasma testing is to be able to understand how the body builds an immune response, not for vaccine purposes, but just to understand the illness and the disease and what we can do with that information to help and maybe build medicine for them. But that's not a vaccine study. That's different.
Got it. Got it. Okay. So if it's your family,
Yes.
what would you do? Which test do you think would help you get comfortable? Because now you're exposed, right? Tell us a little bit about what is your exposure? How are you dealing with the frontline exposed patients at this point?
Right. And we have, as an organization, I'll tell you, I mean, the rules change literally almost every other day or every week. It's like, wear a mask, don't wear a mask. You don't need it, you do need it. You need to wear PPE, you don't need to wear PPE. Or these instances, you don't need to wear PPE. So everything has been really evolving over the last couple of weeks. We thankfully, as an organization, do have enough PPE. We really do. What we're doing is we're streamlining and only having patients who have respiratory symptoms seen in certain clinics and certain organizations, and there everyone is fully. We've all been fitted. We're all completely fitted. When we work in the respiratory clinic, we're fully fitted. Masks, N95 masks. We've got goggles, full face shields, you know, full gowns and everything. We're well equipped, and that is if you're working in and when you work in the respiratory clinic. In regular clinics, we're not seeing patients. We're only doing video visits with patients. Video visits or phone calls. So here we don't need to. But even amongst just the staff on the clinic, it's been about 3 weeks now, we are definitely wearing surgical masks. So we wear our surgical masks and we still separate ourselves from everyone within the clinic. Now, of course, I don't believe that 6 feet is enough, but that is what we're doing. We sort of use that protocol. So in terms of testing, I mean, you know, we wear scrubs, as you can see, I'm wearing my, you know, my scrubs here, my Stanford scrubs, but they go home and I change in the, get out of my clothes in the mudroom. They go straight into the, the laundry room. I am taking off my shoes. I mean, we basically are trying to leave as much of whatever we got exposed to outside of the home. Because you said, how am I protecting my family, right? So we protect our family by being really vigilant with ourselves in the clinic and in the offices and in that respiratory clinic. And then we basically remove all of that before we step foot into the house.
Got it. Okay. Wow. It's certainly very complex. There's a couple of questions coming in on the live stream. So isn't there a concern that you can get it twice? Yes, there are definitely people who are getting it twice. We have some urgent information coming back in from, I think it's Hong Kong last night. They had another 124 odd people, and they're wondering if, these are people who've gotten it the second time, and they're wondering if this is because the virus got activated or if the tests are faulty. What are your thoughts on this?
I mean, think about it. You can get the flu twice, right? I mean, influenza is no different, right? I mean,
if you have, do you get the flu back to back within just a month?
It's unusual to get it within a month, but within a season, right? So for flu, it's a season, right? It goes from September till maybe about March. You can get the flu in November and get it again, like 2 months later, for example, 3 months later. So in the season, can you pick it up again? And this goes back to your immunity, Reena. So if your immune system is down, right? It's not revving up here anymore. It's revving down. Viruses are around. They're around the whole season. Just because you got it once, it doesn't mean you're not going to get the same flu again. Maybe not, but you could still get a strain of the influenza. There's a lot of different strains of influenza. Common cold, rhinovirus. There's a lot of viruses that are out there. So people will say, I got the flu again, but is it actually the exact same strain? Maybe not. Maybe you built an immunity the first time, or maybe you built an immunity, but right now you're revving at a lower level. So even though you have the antibody response, it's not a robust response. So there you go. You're revving low, and there you're going to tip into picking it up again.
Got it. Okay. We have some additional questions. What are your thoughts on, okay, so we've had the May 3rd date as the date for breaking out the lockdown. Now I hear May 15th is the date in LA. So again, kind of counties are doing their own thing. Let's see what California-wide does, what our Gavin Newsom, governor, does. What are your thoughts in terms of how soon do you think we should reasonably consider going back to some form of normalcy? And how would you even decide that? How do we think through when we should start opening up?
I don't think the country's going to look the same for many, many months, Reena. What's normalcy? Is normalcy going into a movie theater? Is it going to a concert with 800 people next to you? That kind of normalcy, I think, is going to take a long time, months and months and months. I think people are just going to be afraid. Now, that's a lot of anxiety in the public, I think. Obviously, that's been built up from that. What is sort of okay? I think getting the country economically back to work and back to being sort of feeling like you can work in an environment in a closed space with other people, I think that is kind of more the normalcy that we're sort of talking about, being able to, go to someone's house or not go out with a huge crowd. But I think we need to see the numbers. We need to see the numbers come down. We need to understand that, what is community spread doing? Like once we open up, this is what's happened in a lot of countries, right? You open up and then you have to kind of, you see the numbers going up again. Well, community spread is still happening. If the numbers are going up again, that means you opened up too soon and too fast and people aren't sort of, following guidelines. And then you're seeing these numbers and counts go up again. And we've seen that already around the world.
Absolutely. Okay, let's see. We have some more questions in there. What do you think about homemade masks? Do you think they're okay filtration for non-frontline workers?
Yeah. So non-frontline workers, probably something is better than nothing. We have been cautioned, and through our organization at Stanford, we are not at all to go anywhere near cloth masks. They are not the most effective, especially if there's moisture on them. So what happens with a cloth mask is just with your breathing and with your exhalation, you will actually tend to kind of, leave moisture on the mask, and that actually attracts the viruses or bacteria to kind of stick to that area. So a moist mask, a dirty mask, and that happens often with cloth masks, is not the best because you feel like you've got protection, but you really don't. You're actually letting things in. So, but if you're going to a grocery store, and I do this with my own kids, when we're going to a grocery store, we wear a mask. We do. If you're going to be out, going for a hike, like we did the Pleasanton Ridge I was mentioning yesterday, lots of people on the ridge, because the trail is sort of, a little bit more narrow, are wearing masks. So those sorts of environments, what the masks do is they prevent your own hands, because, you don't pick up the virus so much by breathing it unless you're in that distance. I don't know what that distance is. Like I said, I don't think it's 6 feet, but you pick it up that way, but you also definitely pick it up by putting your hands and your fingers to your nose, to your mouth, to your eyes, and that's how you contaminate yourself. So at least by protecting your nose and your mouth with a mask, you are protecting your own self from self-inoculation, right? So if you have it on your hands, you've touched a doorknob, you've touched a grocery cart, you've touched the gas station handle, which of course you should be wearing gloves to do in the first place. But if you do, you don't inoculate yourself. So I think the cloth masks have a role, but in the front line, or certainly in our clinic environments and in our hospital network, we're not there. Okay. But that's because we also have supply. And a lot of people are donating right now. They're donating. One of my patients dropped off N95 masks from China this afternoon.
Wow.
She just dropped them off at the door. She said, I ordered these. My husband works in some sort of, a business where they have access. And, these masks came from China. She dropped off, all these masks at our door. So people are doing that as well. And these are N95. So that's the kind of mask that we would take in the organization, but the cloth masks we're not taking.
Okay, got it. You said something so important that I'd like to just spend a couple of minutes chatting about, which is we are starting to see the goodness in people, how compassionate and caring and deeply empathetic people can be. We've lived for so long in a world where we're constantly seeing the dark side of people, whether it's gun violence or rapes, or, there's been a lot of high profile, wealthy people put behind bars for abusing women, for taking advantage of victims. There's just been so much negativity, and you start to lose hope in humanity. And then you get into a crisis like this and you get to see how actually amazingly beautiful we all are as souls. Share something that you've experienced that's blown your mind. I mean, already you shared one example where someone came and dropped off masks. Any other example that comes to you where you've just been so surprised at how giving and caring humans can be?
Sure. I mean, I will say that, from a patient perspective, I have been amazed at how giving some patients have really been with their time, with their willingness. And I shouldn't say patients. I'm saying this in friend circle and just people in general. Making these cloth masks at home, right? I mean, taking out their sewing machines that they haven't taken out in years, and just sort of anything they can do to help. Whether it's making a cloth mask to help people, whether it's, what can we bring you to the office? What do you need? I mean, you've been in touch with all kinds of people, Rena, who are trying to help out, just sort of sustain us and support us with whether it's food or nutrition. I mean, the meals that we're providing families. I mean, this is everyone's heart going out. These donations are helping, so many families in need. So, I mean, we see it across the board. Across the board, we're seeing compassion, we are seeing caring, and I mean, at the tail end here, I'll share a couple of things that I have on my desktop that I wanted to show you, some poetry that I actually have that I wanted to show you. But
oh, wonderful, wonderful. Yeah, you're right. We launched, as Heal Circle, we launched an initiative called Free Family Meals, and in just a week, we raised $10,000 with no marketing spend, bare minimum outreach. It's just whatever the friends did, one Nextdoor post, a couple of Facebook posts, just friends getting the word out. And we were able to close $10,000, which translates into 400 meals to people in need. And this is all coming through volunteers like yourself, like others that are delivering food, that we're going to restaurants, picking it up, delivering it, or the families can pick up. And what's amazing is the restaurants that have joined our cause. We pay restaurants only $25 to create a family meal for 4, a nutritious family meal for 4. So it's vegetarian option or a chicken option, and both of them are full of vegetables because we want everyone's immune system up, But we're able to do all of this in just a week, and it just heartens me to see how everyone's just raising their hand and saying, tell me what do you want me to do? I can help. So it certainly has been amazing. Any parting advice? And by the way, I'm going to request everyone that's on the live call, please, if you have questions for Dr. Duggal, go ahead and start posting them and I will start asking them. But in the meantime, any specific advice for those who are really scared? What is your message to them?
I think anxiety does not help at all. So I think fear and anxiety are something that we really, really want to try and avoid. They are another one of those things that honestly suppress your immune system. We're going back to that immune system again, right? So you're trying to keep your immune system revved up and boosted. And I think that's my takeaway. What can you do to rev up your own immune system? Different people honestly sometimes know that, I'm not getting enough sleep, or I am dealing with too much anxiety. I am dealing with too much sort of fear. So what you can do in terms of, whether it's meditation, whether it's, biofeedback, whether it's, exercising, whether it's yoga, whether it's meditation, I mean, whatever it is that works for you to kind of help calm your stress level down and to kind of keep that at bay is going to only help boost your immunity so you can fight off everything that's out there. We can do it. We can do it. Our bodies are meant to do it. We will take care of it. You don't need to fear it. What you need to do is sort of, jump on the bandwagon of trying to understand how you yourself can take on that role. You've got to be in control of that role.
Absolutely. Absolutely. All right. Well, that's it for us for today. This has been so insightful. Thank you so much for coming to share your thoughts. And yep, no more questions. So we wish you to stay healthy. We send you big hugs. And we will hopefully see you soon on one of our live streams. Thank you.
Mm-hmm. Bye-bye.
And for those of you watching, make sure to tune in, check out our YouTube channel for Heal Circle, and also check out freemeals.org, which is the new domain that we're launching to deliver free meals to those in need, and see if you can join our cause. Until next time, I'll see you soon. This is Reena. Stay corona free, stay smiling.